Hey pregnant moms, this is Dr. Burke-Galloway, author of The Smart Mother's Guide to a Better Pregnancy, blogger, and OBGYN physician. So I want to talk about a situation that may happen to you and give you a heads up in terms of what to do. So let's say your doctor or your midwife sends you to have an ultrasound for any reason. And when you have the ultrasound, it's discovered that there is a cord around the baby's neck. Baby's fine, you feel it moving, everything's okay, but there's this cord. It's called a nucle cord because the neck is what we call nucle, a cord around the baby's neck. What should we do? Should it be ignored? Well, here's what I've done with my patients, because a nucle cord is something that you really can't ignore. Sometimes within 5 or 10 minutes, the next day, it goes away, but sometimes it doesn't. So if you have an ultrasound and they find out that there's a cord wrapped around the baby's neck, what you should do is, number one, pay very close attention and make sure that you feel the baby move. Now some, patients will ask, well, is there something that they can do to make the cord go away? No, unfortunately. Sometimes if the baby has a very long cord, sometimes that cord ultimately gets around the baby's neck. Many times it doesn't remain there, but you don't know if it's going to remain around the neck or not. So here's what should happen. If the cord is around the neck, and let's say you're 32 or 33 weeks, you should definitely have a non-stress test. And I talked about this in another video where they put a belt across your belly and they look at the machine. Sometimes they ask you to click to make sure that it's moving, and that will let us know at least baby's moving. They look at the tracing, the pattern of the heart rate. It seems to be okay. Baby's okay, even though this cord is wrapped around its neck. Now, what should happen is they need to do an ultrasound at least once every 2 weeks to see, number one, if it's gone or if it's still there. And if it's still there, you should have a non-stress test to make sure everything is fine. I have had patients that have had this situation. Sometimes the cord remains right up until they have the baby. Sometimes they have a second or third ultrasound and it's gone. The point is, it should not be ignored. If it's a nucle cord, it should definitely be addressed either by a non-stress test and an ultrasound either 1 or 2 weeks later, just to make sure that everything is okay. So I hope that this information has been helpful to you, and if so, I have many more helpful tips in my book, The Smart Mother's Guide to a Better Pregnancy, that you can pick up at www.smartmothersguide.com, because even if your midwife or your doctor misses a warning sign about your pregnancy, you won't. Until the next time, this is Dr. Burke-Galloway reminding you that a healthy pregnancy doesn't just happen. It really takes a smart mom who knows what to do.